Hey folks, it's Friday, May the 7th. May the 7th. Uh, there is a lot going on. I know I'm kind of late today getting out this video, but I wanted to try and get it out before Friday ended up being over, and I was then making the video on a Saturday or a Sunday again. So I'm going to be as quick as I can about this, but I got an awful lot to talk with you about. First off, an update on our CARE South Carolina herd immunity campaign. You know, y'all are making pretty good progress on this. We've got 60% herd immunity right now. That's right, 60%. We are getting closer and closer. Some departments already have it. The providers, by the way, have 70% herd immunity. Go provider team. We only need about 56 more staff to step up and go ahead and get the vaccination. Um, this is an encouragement. Please don't take it any other way. I know a lot of folks um, are just pretty confident that they're not going to get the vaccine. So I understand, but if you're kind of on the fence and you're saying I probably will, go ahead. If you're in that 56 group, you're going to push us over the curve, and there's going to be a lot of money given out around the 1st of June. I'm going to sweeten the pot too today. I'm going to give the sites a little bit of motivation. And we're going to say that in each of the sites, if 80% of your staff reach immunity, and remember that is by vaccination or by documented antibodies, if 80% of your staff reach immunity by the end of May, everybody gets a free vacation day. So we're going to track that pretty close. I'll try to give some updates on where that stands for each of the sites and see which of our sites can get a free vacation day. Now, that's 80% for the sites. We're still not changing our overall 70% goal for CARE South, but we are going to up the ante a little bit. You know, Dr. Fauci recently said this week that he is afraid that it really is going to take an 80% herd immunity percentage across the nation, and that's because of all those variants that are now really beginning to come into play, and that we just haven't been able to really get our arms around how all of those variants are going to impact. One thing that we do know is that they spread quite a bit quicker. So let's keep our campaign going and see what we can do at CARE South to reach our own herd immunity. A few things going on. Most of y'all by now know that it's been Nurses Week, and what a glorious way to celebrate the folks that during this whole year, over a year really, of the pandemic, if there was any group, our direct care and our frontline nurses and all of those that stood up behind the vaccination efforts and the work with patients to assure that their health and well-being kept going, our nurses have really been extraordinary. So it's been a really incredible week to celebrate the amazing job that they have done. May is also Mental Health Awareness Month. And if there's ever a time that we need to be more tuned in to mental health awareness, it is during a pandemic. There is no stigma in depression and anxiety during a pandemic. It's tough. The stress has been enormous. In the beginning of the pandemic, we were all locked up. Depression was practically normal. So I really want to encourage everyone. We have an amazing behavioral health counseling staff to provide employee services. I also understand that if you want a referral to go out, we're very, very pleased and happy to do that. So just understand that it is not a stigma. It's not anything to be embarrassed of or even afraid of. Depression, anxiety, The stress of this pandemic has been enormous, and frankly, I don't see how any of us couldn't have been affected one way or the other. Take care of yourself. Take care of your family and friends. Mental health is such an important aspect of the health and well-being that is part of our mission. It's also Hepatitis Awareness Month. You might have already heard the email. It used to be that hepatitis was practically incurable, but now with new medications and things, hepatitis is really very on its way to having a very good treatment course. But you can't tell about it until you get tested. So remember that. Let's stay aware. For those of us who are called baby boomers, we need to be tested because it can be a sleeper type of disease. And treatment as early as possible is very, very effective. I want to talk a little bit about our campaign that we are rolling out. We are calling it Sleeves Up Campaign. You know, our PD counties, Dillon, Marlboro, Chesterfield, Darlington, and Lee, are unfortunately amongst the worst in the state around the percentage of residents who have been vaccinated. Now that's frankly embarrassing. We've really got to step it up because frankly, if not us, then who? There's not many other people out there. We've done about 40% of the vaccines that have already been done, but there is still an enormous number of folks that need vaccinations in our communities. So we have really engaged on an intensive campaign. We call it Sleeves Up, and we've looked at it in 3 different ways. The message, the messengers, and what are the tactics that we're going to use for this. We really want to look at, we've got a lot of data that DHEC has gotten very good at compiling, and we want to look at communities where the vaccination percentages, the vaccination rates are the lowest, and see if we can improve those rates by going out there and really focusing on those who haven't had the vaccination, especially those in the minority population. We need to close these gaps. You know, the pandemic has really revealed disparities like have never been revealed before. And we don't want that. It's become an awareness amongst all of us that we really must become more mindful of taking extra efforts to assure that we close the gaps of disparity. So our campaign along those 3 areas, designing messages that can really reach out, dispel myths, and give facts to folks. The trusted messengers, whether it's the evidence tells us that it's often the provider, the physician, the nurse practitioner, the clinician that the person is familiar with that is the best trusted messenger. Connected leaders are also like sheriffs in our communities, council people, our local legislators, and of course the pastors of our large churches and small rural churches. They are connected leaders, and they are very important voices that we want to make sure that we can help get out into the community. We're going to use a lot of different tactics. Of course, we're going to have flyers. We're going to have our community health workers and outreach workers out there papering the communities with information that, as I said earlier, dispels myths, gives accurate and true information, tells about how and where and when they can get vaccinations, where our Mobies will be, where we're going to have a pop-up event, and really do everything, pulling out all the stops. The new director at DHEC has a new word. We all often talk about thinking outside of the box. Well, he said the other day, folks, there is no box. So come up with ideas, no matter how wild they are. Let's just do everything we can to get vaccinations out into our communities and get this pandemic over with. So our campaign is going to be pretty intense. And if you've got any ideas, be sure and share them. Share them with Joe Biddle, Amanda, any of us. And we'll certainly take them as wild as they may be. Something may click. Last, we want to join in a congratulations to our very own Jerry Andrews, nurse practitioner. Jerry is an Amanda Cockcroft Leadership Fellow. She's been accepted into that program, and that is a very high honor. So kudos to Jerry, and we're really looking forward to the things that she learns and the new skills and attributes that she brings to the organization. So that's about it. It's a good weekend. I think the weather's good. I'm looking out in my office right now. I see some nice blue skies, so please enjoy. But be safe. We're not out of a pandemic yet. For those of you who are vaccinated, there are some really good opportunities now as the CDC has released some guidelines and told us what we can and cannot do. So y'all stay in touch. I'll talk some more next week, and we'll go from there. As always, email me with any of your questions, concerns, or ideas. All right, talk to you later. Bye-bye.